All right, welcome to our webinar today. We're really excited in order to show off all of the work that IMO has worked with the Metro Health system on over the last several months. I'm sure many of you, I just scrolled through the attendee list real quickly before I started talking. I've talked to many of you about this solution so far. And so we are very lucky to be joined today by Dr. Greco and Eric, who are going to run through from both a provider perspective as well as the revenue cycle perspective, the enhancements that IMO and Metro were able to work on together in order to help reduce overall denied claims, as well as just improve efficiency across the provider workflow and the revenue cycle. And that IMO has worked on this solution is because we know that healthcare has a data problem and it affects everything from patient care to our reimbursement to our downstream efforts around our data. If we don't have a solid strategy in place in order to maintain the terminology that's being captured at the point of care, add in any additional insights that help us get to a more specific code that, yes, is great for reimbursement, also great for patient care, also great for just better quality data overall. IMO has been around for 30 years working in clinical terminology. Content is one of our biggest specialties that we have. And so this is why IMO was well suited in order to create this content and maintain this content that the Metro Health system has then been able to use within the Epic system in order to help solve for a problem around denied claims in really these two buckets. So non-primary codes, unspecified codes, these are comprised of many different types of code groupings, things like external cause codes and manifestation codes, things that are great for documentation, but can't go out the door as your primary diagnosis. Similarly, things like unspecified laterality, then ultimately causing denials and really kicking off what I've talked to many of you about over the last several months, this denial cycle. And how can we avoid that denial cycle by catching these as upstream as possible? So that's really why we've created our administrative coding assistant sets. And with that, I look forward to hearing Dr. Greco and Eric share more about the solution within their system.